Welcome back to the show. Earlier we learned about hip labral tears in the Medical Minute.
Now Dr. Huang with Colorado Springs Orthopaedic Group gives us his doctor's notes on how it's treated.
Hey there, we're back from break. This is Dr. Michael Huang at Colorado Springs Orthopaedic Group. We're still talking about hip labral tears, which can be a very painful tear that occurs in the hip. And we see that predominantly with athletes that will squat quite a bit, so this can happen at the gym, and it can be associated with sports such as hockey, figure skating, gymnastics, dancing, football. For the patients that aren't as active, they can still suffer from a hip labral tear, and this is mostly because of the position that the hip is put in a sitting position. If you're going to go into the squatting position or squatted position, you really want to be very careful about where your knee alignment is, the kind of flexibility in your spine, but a lot of times most athletes and most patients have no way to avoid it. We typically diagnose this with a history and physical examination. That's a consultation with us. We usually follow this with x-rays and MRI. Specialized MRI can really see this very small structure that can be at risk for athletes and non-athletes alike. Treatment program for this type of tear, if you happen to have one, includes both non-surgical management but also surgical management. Non-surgical management oftentimes includes physical therapy, anti-inflammatory medications, rest, activity modification, and we certainly have a lot of advice in terms of how you would lift at the gym or change your overall activity level. Surgery sometimes is required to fix the labrum, as it is a soft tissue structure that has minimal blood supply, and sometimes we are forced to do arthroscopic or minimally invasive hip surgery that can get you back doing the things you want to do within 4 to 6 months. If you're having hip pain and it's lasting more than 6 or 8 weeks and has not improved with just your basic rest and maybe some ibuprofen usage, you should feel free to come in and see us. That's when we begin the process of grabbing your physical examination and getting some basic x-rays to see if you're at risk for one of these tears. Those are my doctor's notes on hip labral tears. You're welcome to come see me, Dr. Michael Huang at Colorado Springs Orthopaedic Group, or visit us at csog.net, and we look forward to seeing you.
Feeling like we need to do a little hip stretching after that one, don't you
Does feel good.